Hi students, I am going to go ahead and we're going to talk about what's going to all happen this week. We're getting down there. We only have a couple of weeks left. So with week 16, you will have a discussion, okay, and this is going to be on ethics and ethical coding. You'll have an assignment on communicating with providers, and you're also going to have an assignment on querying providers. All right, so let's go ahead. Make sure you review Chapter 1 PowerPoint slides. This talks a little bit about medical necessity. I'm going to pull it up. All right, so here, just kind of go through it. This is the very first chapter of your textbook. All right, so a lot of this with health insurance claim, we went through a lot of this already. Remember, we talked about the CMS, Centers for Medicare and Medicaid. We went through all our ICD-10 coding. One thing I do want to talk about is medical necessity. Medical necessity is linking the procedure service codes reported on claims to disease codes to justify that procedure. This is a great example. So the provider will not receive reimbursement when a claim submitted with a CPT code for a right knee x-ray and then the diagnosis code is shoulder pain. Okay? They don't match up. So if they're going to have a right knee x-ray, you should make sure that the diagnosis is going to be something with knee pain or knee arthritis or something in that area. Okay, so as you can see, the medical necessity, it's going to come back. Example 2, the provider will receive reimbursement when that CPT code and ICD-10 code do match. So if somebody comes in for a chest x-ray, diagnosis severe shortness of breath, those match up. Okay. So just keep in mind with that, that's medical necessity. You want to make sure that procedure and those diagnosis codes match up and make some sense. All right, so the rest of this you can just kind of read through. I'm not going to go through each of these. Okay. The next thing I want to do then is talk about medical necessity. Kind of talked about here, and then it's going to be with medical necessity. It's going to be with physician queries. Here we get into professionalism as we round this one off. So, okay, so let's go back to I want to go to HIT 10 to 10 coding queries. Okay, medical necessity, we just kind of talked about that. So let's go back to that example. We have chest or a knee x-ray and they put in shoulder pain. Okay, so something's not right here. You're going to have to query the physician, and right here, this is why, because the medical necessity did not meet. So when you query them, it's going to be a communication tool or a process. You want to clarify that documentation. Make sure there was accurate code assignment for what's going on. So once again, things aren't making sense. So you need to query the physician on saying, hey, did you possibly mean a shoulder x-ray or did you mean that they had knee pain? What's going on here? Okay. So with this, when we talk about query, you're just not going to go up and ask the physician. You want to do a query. So with that, you want to make sure that you want to be clear and concise, contain clinical indicators from the health record, present only the facts. You don't want to bog them down with all this information, and then be compliant with the practices outlined in the brief. Never say if you would code this, you're going to get more reimbursement or more money back. So you can just read here why query. What to query. I'm still going to go with that example with the x-ray in the knee, and this is how I kind of want to going down here. on how to query. All right. So open-ended query. All right. Leading and non-leading. This is the biggest thing right here. So a patient was admitted with pneumonia. The history and physical exam reveals that the white blood count of 14,000, a respiratory rate of 24, temperature of 102, heart rate of 120. They have hypotension and an altered mental status. Patient is administered IV antibiotics and IV fluid resuscitation. Okay, so leading, you put down the patient has an elevated WBC, they have tachycardia, and they were given IV antibiotics for their Pseudomonas cultured from the blood. Okay, so this would be asking, are you treating for sepsis? All right, that's leading. You're just basically coming right out and asking them. Non-leading, you want to put, based on your clinical judgment, can you provide a diagnosis that represents the below listed clinical indicators? Okay, so here in this patient admitted with pneumonia, admitting history reveals the following, and you put everything down which we had up here. Then you would go ahead and just say, please document the condition and causative organism if known in the medical record. All right. So that's non-leading and leading. Those are the two different. So here's another example of multiple choice query. With this scenario, they have a hip fracture, history of chronic congestive heart failure. They had a recent echocardiogram. Patient's home medications include 3 meds. We want to document. This is leading. Please document if you agree the patient has chronic diastolic heart failure. And remember, non-leading, you are going to list everything out. Okay? So those are the two difference in leading and non-leading. So basically what we want to talk about here is the query, how you query a physician, and you're doing it because you need to know if their documentation leads to medical necessity. That's what I really want you to take away from this week. So we have the query, medical necessity. So let's go on to okay. So this week a little bit different. I went through the 2 PowerPoints. Week 16 is ethics and ethical coding. This is what I want everybody to answer. You need to tell me, what does ethical mean to you personally? So you may have to look this up if you're really unfamiliar with ethics. Okay. I want to know also why demonstrating ethical behavior is important as you pursue a career as a MA. And then here we have just different questions that you need to answer for your discussion. Okay. You also, if you use any resources or references to influence your thoughts, make sure you put that link at the bottom of your post. Okay, and then after completing your post, you need to reply to 2 other classmates. Okay, 2 other classmates to get the full points for this. There is a special rubric for this discussion, so you can go ahead and review that. All right. So week 16, communicating with providers. I want you to read the articles about communication in the links below. Okay. Then, informal document, provide detailed answers to these questions. Okay. So, it's not hard what we're doing. Just take some time, review the information, the material. Week 16, querying physicians. Okay. What you want to do, all 3 scenarios are worth 10 points. You want to review each scenario for compliance with querying rules. Okay, and I talked about this up above. The definition of a compliant query is meets the criteria, clear, concise, based on clinical indicators. Remember how we listed them out in the non-leading? Okay, so what I want you to do, Yes, no, okay, as long as more options are giving. So in a Word document, I want you to write a short paragraph on each one explaining why the query is compliant or is it not compliant. If the query is not compliant, share what you would change to make it compliant. So again, I want you to read through the 3 scenarios and tell me what you think after what I just went through. If you have any questions on this, please email me. Part 2, what I want you to do is share a draft of a coding query for this scenario. Okay. With this, they're giving you the information. So what I want you to do, I don't care if you do leading or non-leading, that's up to you, but make sure you review on which one you're going to do and how it's going to be mapped out. Okay, this section's here worth 10 points. All right. So that's all you have. You do not have a quiz this week. Please, if anybody has any questions, contact me. Great. Have a great day. Thanks.